Hello and welcome to The Extra Mile. I'm Linda BOUDREAUX. Our guest today is Dr. COBY BOUDREAUX. He is an optometrist with Ascension Optical out of Gonzales.
That's right.
I could not read my own writing, which happens all the time. Corey, thank you so much for being here today, for coming across the basin to be with us. Now, optometry is a profession that's been around for a long time, and I think most of us have an optometrist, have been to an optometrist, but for those maybe who aren't quite sure what their eye doctor is called, what do y'all do?
Yeah, well, a lot of people think that we just do glasses and contacts, and that's the way it used to be, but now we're doing a lot of diagnosing and treating of ocular disease. We can help manage diabetic patients, we can help manage cataract patients, glaucoma patients, macular degeneration patients. So unless it involves a blade or a laser, we can help manage and treat that patient.
So this is, I guess the profession is expanding, and this is part of state regs and education and all those kinds of things?
Absolutely. I mean, in order to do more in our field, we do have to get legislation passed. But right now, I think we're all at a good place in optometry. We're happy to be able to do what we do and be able to treat our patients without having to send them on to another doctor if it's not needed. We can take care of them in-house.
Because you're usually the first people we go to.
Yeah, we do think of ourselves kind of as that primary eye care.
Yeah. So how did you become an optometrist?
Yeah, well, I've been wearing glasses since I was 5 years old.
So you were a little one starting off.
That's right, and my eyes were changing so much I was at the eye doctor every 6 months. So I became interested in the profession. And after college, still trying to figure out what I wanted to do, went back to my hometown optometrist and shadowed him, and he convinced me to apply. And about a year later, I was in Memphis at an optometry school, becoming an optometrist.
And my guess is that you love it.
Oh yeah, I couldn't be happier with the profession I've ended up in. Absolutely.
So, are there changes in optometry? Is the field progressing? I mean, technology is in so many parts of our lives. I'm wondering
Absolutely,
about
it's definitely becoming automated, even down to the charts. I mean, we're pretty much all mandated to use electronic charts now.
Including optometrists?
Right, you won't see much paper around the office anymore. But the diagnostic tools, the computers that are able to analyze the cornea, the front part of the eye, the lens, the back of the eye, the retina, help us look for those changes that might need an ophthalmologist's care. Such as bleeding for diabetes, macular degeneration that needs an ophthalmologist. We can diagnose those patients in the office with these computers now. And if nothing is going on, we can save them a trip from having to go to their ophthalmologist.
Okay, so you can tell us what's happening.
That's right.
What about just in terms of correcting vision?
Well,
which is what you've been doing a long time.
Probably the biggest advances there are going to be in contact lenses. I think, as you know, we started out with the old hard lenses, and plenty of people today still wear the hard lenses.
I didn't think anybody still wore them. They're not very comfortable.
They're not as comfortable. If it's a good fit, if the fit is right, it'll be a comfortable lens. But the vision is much better in a hard lens than a soft lens. But most people these days do want that comfort, so we do use a soft lens probably more than a hard lens. We do have a hybrid lens now, which is a hard middle with a soft outer skirt. That gives you the best of both worlds.
That sounds like a dream.
It's a great lens, and we use it quite a bit at our office in Gonzales.
And what about lenses like for astigmatism or for being nearsighted and farsighted? How do all those things work now?
Well, the astigmatism lenses haven't changed much when you talk about glasses. We do have a lot of people coming to the office who think they can't wear contact lenses because of the astigmatism.
I had always heard that.
Not true anymore. We have plenty of options for astigmatism patients in contact lenses, soft and hard. Being nearsighted and farsighted, what you're going after is maybe those patients who are turning 40 and over who are having trouble with their near. Well, the old line bifocal really is still out there, but most people choose the no-line bifocal, what's called the progressive lens, which makes a smooth transition. There's no line in it, and it gives you that far, that intermediate distance, and that near vision all in one lens.
So these are all the changes that are happening just in kind of the products and the hardware that we can get to kind of help correct our vision. And I guess the next thing I want to ask is just good eye care. I mean, eye health is a really big deal, and I don't think people even necessarily pay attention to eye health. And I'm not even sure what I'm asking about when I bring it up, but I'm sure that there are things that we should do and can do.
Right. I think if people feel they have good vision, they feel like their eyes are healthy. And more often than not, that's true. Good vision means good eye health. However, there could be some things that are going on that don't affect the eye, that doesn't affect vision. Plenty of times we'll see signs of diabetes in the eye before a primary care physician even picks up on it.
Really, it shows up?
It can show up in the eye. We can see early signs of glaucoma. We can see early signs of macular degeneration. Things that we can control if caught early enough before it gets on to a more severe stage. A lot of it depends on your age, how often you should come to an eye doctor. A lot of it depends on your vision. Nearsighted patients typically have a longer eyeball, which means that eyeball will stretch and that tissue inside the eye will stretch. It can cause tears in the retina, retinal detachments, things that only a good dilated eye exam will reveal.
Okay, so it would be important then to go once or every year or every other year for that eye exam?
Right, again, depending on your case, at Ascension Optical, and it's also teamed up with Williamson Eye Center is who we work for. We recommend once a year that our patients come back.
I think most optometrists do.
I think so too. Now, there's a lot of vision plans that will only pay for an eye exam every other year, and we understand those patients only coming back every other year. But we also like to dilate our patients when they come in. And a lot of patients don't enjoy being dilated, and we understand that, but it's for your own benefit that we do that. It's not because we like to dilate your eye.
So when you dilate people's eyes, what are you looking for in there anyway?
We're looking at the retina mainly. We're also looking at the optic nerve to determine if there's any signs of early glaucoma. We're looking at the macula to see if there's any signs of macular degeneration. But also we're looking around the periphery of the eye, way out in the far edges of the eye. That's where a lot of retinal tears and retinal detachments can start. Whereas if you're not dilated, we can see inside the eye a little bit, but probably wouldn't be able to see that area that might have that defect.
Okay, and what exactly is a retinal tear? Or
well, okay.
Yeah.
If you think of, we don't use film in a camera anymore, but if you can think of film in a camera.
Back in the day.
Back in the day. Your retina is your film. Okay, so the image comes in through the eye and hits the back of the eye where the retina is.
Okay.
Now, in order to get a good picture, you want that film to be nice and smooth and flat. You want your retina to be smooth, flat, and healthy. If there's any imperfections in the film or in that retina, you won't get a very good picture, and you might not see very well when it comes to the retina.
And if you have a retinal tear, because that sounds like a scary thing to have.
It can.
Can it be fixed?
A retinal tear can be fixed. You want to catch it early. It's kind of like a crack in the windshield.
Okay.
You want to catch those early. If you leave it alone too long, that crack may start to run. And if it runs through the center part of the eye, there can be some irreversible damage that's done. So you want to catch them early. And the way to catch them early is to look for what we call flashes and floaters. A lot of us have floaters. It's those little cobwebby, black, fuzzy things floating around in our vision.
What is a floater anyway?
A floater is it's the gel inside the eye that starts to condense down and liquefy. And instead of being a perfectly clear gel, now it has these little imperfections floating around in the eye. And a lot of floaters are really not causing any harm. But a floater can be the beginning sign of a more serious issue.
Okay.
Which is why we do recommend at the first sign of floaters, go to your optometrist, let them dilate your eyes, let them look around just to be sure.
Okay. And flashes, you said?
Little white flashes of light. Some people say it's like a little lightning bolt or a little camera going off and they're not sure where that light came from. That could also be a beginning sign of a retinal issue.
So people just need to be aware and
correct. Don't just sit on it and hope it goes away. Just go ahead and get a dilated eye exam so that everybody can rest easier.
Okay, and not to worry. And a lot of these things, if they're taken care of early, really are manageable and not that difficult.
Correct.
I think, which is a good thing.
Right.
Now you do something that I have at your company. Have something called the Chroma
Gen lens.
I have never heard of this. I think it's just the most exciting thing.
Well, we didn't either until about October, November of last year. Our office manager was at a Vision Expo, and she came across this booth where the Chroma Gen, the guys were, and they were telling her about how they were helping people with dyslexia. Well, that hit home with her because she has a son with dyslexia and has him in a private school that is specifically designed to help kids with dyslexia. So, it struck home with her. She said, well, how successful is it? Can we do it? And he said, well, yeah, let us come down to your office. We'll test some people. We'll see how it goes. Well, what we managed to do was get in touch with the school. It's called Brighton School.
Where her son goes.
Where her son goes. It's in Baton Rouge. And they sent about 20 kids over. And we tested all of them, and we put them in Chroma Gen lenses. And I would say at 70, maybe 80% of the kids had a benefit after wearing these lenses. Even the principal was very encouraged. And the Chroma Gen company decided to go ahead and fit everybody at that school.
Did they really?
With Chroma Gen lenses. That's right. So,
wow.
And we just did that in December, January, so we're still waiting on like a long-term report. But when you do a before testing, then the Chroma Gen, and then you do an after testing of reading rate, many times you hear that difference in reading rate right away, right there in the chair.
That is just incredible. So we don't really know, or do we know what causes dyslexia and what's going on with these lenses? I mean,
yeah.
Who would have thought?
Yeah, I don't. Somebody out there probably has a real good understanding of dyslexia. I don't.
Which would not be anyone at this table.
No one in here does, and no one at our office does. And we don't claim to be dyslexia experts. All we're doing is trying to provide another solution.
Right.
Okay, and if we can help anybody out there, then we feel we're doing a good thing. Chroma Gen tells us that dyslexia is caused when the signal from one eye going to the brain and the signal from the other eye going to the brain travel at different speeds, and they reach the brain at different times, causing the dyslexia type symptoms. So what they took was an old idea of using filters. The filters idea is not new. Okay, people have been using these filters, or what's called overlays, like a transparency sheet.
It's usually a color, isn't it?
And it usually has some kind of color, and you place it over your reading material.
And what would that do for you?
Well, again, the science behind it, I'm not so sure.
But the outcome?
But the outcome was helping dyslexia students read more comfortably.
Oh, so they were using filters for dyslexia already?
Correct.
Okay.
But it was one filter. Well, Chroma Gen says, well, if we think dyslexia is because each eye is acting differently, then we don't need one filter. We need two filters, one for each eye, that are different from each other. Now, they also stumbled upon this dyslexia thing by accident. They first started treating color vision.
For people that are colorblind.
For people that are colorblind. And they started using lenses such as these to help with color vision.
So that's a red lens.
Reddish, kind of pinkish lens. Okay. But we also have other different colors. There's a yellow. There's a blue. And they were putting these filters in front of people who were colorblind, and it was helping them to distinguish between colors much easier.
So people that maybe couldn't see red and green
we use these filters. Now, I still don't think these patients are seeing red and green like you and I would see red and green, but they would be able to tell that there's a difference there.
Okay. Yeah.
Okay.
So stoplights would be traffic lights.
Correct. Instead of it all looking the same.
Yeah. Which one's bright? Yeah.
Right. So they would send the patients home thinking, okay, we've helped them with their color vision. And the patients were calling back later saying, my color vision's great, you've helped me, but my reading has gotten better.
So would these people also be dyslexic, or would it help people that just had trouble maybe managing words?
We do think that even if there's just a reading problem and not formally diagnosed dyslexia, that we can help these patients also. Absolutely.
Because I think there are probably, and I'm no expert on any of this, but I'm thinking that there are probably lots of reading problems that are not caused by dyslexia.
Absolutely, absolutely. But now dyslexia also is a neurological problem. Okay, it's not an eye problem. So in order to be diagnosed dyslexia, you have to have an eye exam to make sure the eyes are okay.
Right.
You have to have a hearing exam, make sure the ears are okay. We have to know that the patient is able mentally to comprehend what we're asking the patient to comprehend, making sure the patient was brought up correctly, had the right education.
Okay, had been exposed
had
to
been
reading.
exposed to proper things, but the patient is still falling short of their peers.
Okay.
Okay, so again, we're just using the eyes to help right now. We're not fixing dyslexia. We're not curing dyslexia. But we also want patients to understand dyslexia is not an eye thing.
It is.
So you can't go to your eye doctor. You can't come to me or another optometrist and ask them to diagnose you dyslexia. An optometrist is not going to be able to do that.
Okay.
They'll let you know if there's an underlying vision issue.
Right.
And then once you fix that, you move on.
So if a person who's been diagnosed with dyslexia decides that they want to read better, what we now have as of like hot off the press.
At least in Gonzales.
In Gonzales. Do you know if it's anywhere else in Louisiana?
It is not in Louisiana. One thing Chroma Gen wants to do is, and this sort of gets into the business side of things, but Chroma Gen gives it to one office.
In a state? Or in an
At
area?
least in southern Louisiana.
Okay.
I'm pretty sure they would allow somebody in northern Louisiana
so you don't have
to do it.
Shreveport does not have to drive to Gonzales.
I'm not aware, but we have had patients from Lake Charles come
Okay.
to Gonzales. We've had patients from New Orleans and Metairie.
Okay.
We've had a patient from Mississippi come into Gonzales.
And Chroma Gen can decide that. You know, they can market any way they want.
Sure. Now there are contracts. So right now we did sign a contract where we would be the only facilitator in southern Louisiana. But we know we know 2 patients who have called Chroma Gen, and Chroma Gen saying, find us a doctor in Mississippi.
Okay.
You know?
Yeah.
So we don't want patients to have to come very far. But right now we are the only source in southern Louisiana for sure.
It's pretty exciting, and I'm wondering if very many people are even aware that this would be a possibility.
I don't think so.
Well, after today's show, folks in Acadiana will at least
we ran in the
aware.
Advocate, which is I think how you found us. And we got a good response from that. And once this show airs, I think we're going to get an influx of people at least to try it.
Yeah.
And again, we want to tell patients too, we are not going to fix everybody.
About 70% of the
We feel
students.
like we're fixing about 70 to 80% of the students that come into the office. Dyslexia has a wide range of symptoms.
Yeah.
We are finding that we're helping mostly with the kids who find words are moving on the page. Words are floating on top of the page.
Okay.
The spaces between the lines are changing. So if there's movement involved, we do find these lenses are helping to keep those words, letters still.
Where they belong
Right.
on the page.
Right. So that is kind of the student we find we are helping most. But we would be willing to try these on anybody. There's no obligation to buy lenses when you come see us. We want the opportunity to put them in front of you and see if it helps you.
So how does that work? You brought a pair of blue frames with you.
Yeah. Okay.
How does this whole thing work?
Well, we give a patient a reading card with some random words like car, hat, come, see, dog. And we have them read out loud, and we time them for a minute, and we see what their reading rate is for a minute. And then we'll have them first we wouldn't have them put this on because we're going to test one eye alone. So we choose an eye of which to start, and we use these natural colored filters here. Chroma Gen was able to take these colored filters that they were using
The pretty yellow.
for color vision, and they thought, a lot of patients probably aren't going to want to wear glasses that have these colors.
Unless, of course, you're an old hippie.
Right. So they were able to achieve the same filtering effect with more of a neutral color.
So that they will all be kind of smoky?
They'll all be kind of smoky. Now, if the child, and it doesn't have to be a child.
I was going to say, is there an age that this works better for?
Not at all. If the patient doesn't even want to wear glasses that look like this, we have a contact lens.
Oh my God.
Yep. Now this one's green, and I'm not sure if the camera's picking that up. But
I think if you hold it up, yeah.
But that's a green. And only the area of the pupil is colored. So the whole contact lens is not green. So it's really pretty...
It's filtering. It's pretty, yeah, it's really
and it's
high
not
tech.
noticeable. If I'm looking at you, your whole eye wouldn't be green. It would just be the very center where that filter
And we
is.
think you had lovely green eyes.
Right.
Okay.
But anyway, back to what you were asking about. We let the patient decide. We do one eye at a time. And we'll show them kind of the old optometry, what's better, one or two. And we let them decide what helps that page look clearer, what keeps those words more still, what makes them feel more comfortable. And we'll go through their 16 lenses here. Okay, and we'll compare all 16 lenses until they narrow it down to one.
Okay.
And when they do that, then we'll take that lens and put it in this, it's called a trial frame. And we'll put that on them, and then we'll do the same thing with the other eye, which is better, one or two, going through all the remaining lenses until they narrow that other eye down to one. So at which time...
Now, the lenses then, and you said this earlier because of the speed that information is getting to the retina anyway, the lenses will never be the same.
Correct, because once they choose the first eye, that lens goes in there and it's now out of play for the other eye.
Okay.
Right. So now they've chosen a lens for each eye, and we give them a different reading card so that they're not memorizing, and we time them again. And parents want to hear this. We always encourage parents to be in the room. We want parents there listening, seeing, because it's quite an expense for the glasses, so we want them to know what they're getting. We hope that there's going to be a large increase in reading rates. Okay, but that's not always the case. It is plenty of the time, but sometimes there's not always an increase in reading rate. It's what you hear a lot of times that the patient or that the parent appreciates. The kid, the student, patient just starts reading more fluid. They start reading smoother. They make less mistakes. And that's done all within 15 minutes.
Wow.
You know, we just put the lens on and have them read.
So basically what we're saying is they know how to read, they just can't see the words. And once the
it's
lenses
not
are
registering
in there,
for some reason.
Yeah, and so once the lenses are in place, then the skill that they already have, they're able
becomes
to...
easier. Okay, now there still may be some teaching, some education that needs to happen. And what we want to know is, well, what about if we saw that little improvement within 15 minutes, a month later, 3 months later, how are they performing in school? What do their grades look like?
Are they happier?
Are they happier? Are the teachers happier? Are the parents happier? Because it affects a lot of people.
It does, it does.
You know, and we're still waiting on some of that feedback.
But it's so exciting. Let me just ask you this, because we only have a few minutes left,
Sure.
and I want to make sure that we cover the things that people need to know. These lenses, as they stand, are to correct dyslexia, but what if they have other acuity problems, other vision problems?
Yeah, absolutely. If you're nearsighted, we can put the nearsighted power into these lenses.
Okay.
Or if you're farsighted, put the farsighted power, the astigmatism power. We can put all that into these lenses or into the contact lens.
So you can have corrected vision and be able to read.
Correct.
I mean, ideally.
Correct.
Okay.
That's right.
That is such an exciting thing for families.
Yeah, we're happy with the results we've seen so far. And your glasses won't look like this. You can pick from any frame.
Any frame at all. Are they thick, heavy, ugly, bulky glasses?
Any frame you want.
Okay.
However you want. If you like the big, thick plastic frame or if you like the thin wire frame.
Okay.
You can choose whatever frame you want. We'll cut the lenses to that frame. They will be these colors, though.
Okay, they won't be clear lenses.
They won't be
so
clear,
you look
though.
like you're coming in out of the sun all
Correct.
the time. That's really all that looks like.
Right.
Is there anything else that people need to know? Well, before we do that, very, very quickly about the color blindness thing
Sure.
again, about the color lenses. Is there a lot of color blindness? Is that a common problem?
It is. Now, it's mostly in men.
Yeah.
Okay, and it comes from the mom side of the family. Okay. So we had a well, he wanted to be a Navy SEAL. Navy SEAL turned him down because he was colorblind.
Oh.
We put him in a contact lens in each eye for his colorblindness, and he was ecstatic. He could pass the entire color vision chart.
Wow. Wow.
Yeah. So now I'm not sure if he went on to be a Navy SEAL yet,
but his eyes weren't.
We
keeping
opened
him
up
from it.
what was a door that was closed for him.
Wow.
We had opened back up.
What rewarding work you're doing,
So,
Corey. You
it
really,
was gratifying.
really are. So in the last seconds that we have, I guess if people want to get in touch with you, they can just call, go to your website or whatever.
You can go to, I think it's ireadbetternow.com. You can call Ascension Optical in Gonzales, and we'll get you all the information you need. There's also a survey on that ireadbetternow.com. We suggest for the patient or the student to take the survey. We don't want the parent taking the survey for the student.
Yeah, that would be cheating.
And the parent might be surprised at some of the answers, because it's hard for us to understand exactly what a dyslexia patient is going through.
Yeah, it's very exciting. It just brings hope again. So
absolutely, it's another option.
It's hope. Thank you so much, Corey.
Well, thanks for having me.
And thank you for watching The Extra Mile.